closely. There's a lot in here, and we'll be talking about this a little bit later on. But this is a drawing from a frustrated community member who's had a lot of dealings with the Provena Health system. The next thing that I wanted to go over real quick with you is the blue sheet that you have. And this blue sheet is a diagram of the Provena Health system. And I just want to review it with you real quick because our local hospital is now part of a corporate health system. And that raises a lot of issues, and part of us being able to address those issues, we need to understand the structure of the health system and who's accountable and so on. So that's why we've included this in here. And if everybody looks at it, I can explain it real quickly. At the very top, there's a box that says Provena Health. Provena Health is the name of the parent corporation, and Provena Health is a nonprofit corporation. And everything below Provena Health is either in a box or a circle right here. And the items that are in a box are nonprofit subsidiaries. The ones that are in a circle or an oval are for-profit subsidiaries. And the way that the health system, that Provena Health system is structured is that there is this parent corporation and it owns 3 subsidiaries, and then each of those subsidiaries, and I didn't show this on the drawing, but each of those subsidiaries operates local units, such as our hospital. And the part that we're interested in, because of our hospital, is the part that goes off to the left. So we have Provena Health, the parent corporation. They do file 990 forms, which are public record, and so their board members are publicly available from those records. The subsidiary that governs our local hospital is Provena Hospitals. And it gets confusing because there's always the name Provena in each of these levels. But Provena Hospitals is a subsidiary company, and it operates 6 hospitals total, including Provena Covenant Medical Center, our local hospital. Provena Hospitals, the subsidiary, is a registered organization. They do file 990s. They are nonprofit, so you can get some of their public records. Okay? Underneath Provena Hospitals, like I said, is Provena Covenant Medical Center, our hospital. Our hospital no longer exists in the eyes of the state as an independent legal entity. That is why the list of their board members is not public record. Provena Covenant Medical Center does not have to file its own 990s. It is just one of 6 that's governed by the Provena Hospital subsidiary. Okay? So that's part of the struggle. When your local hospital, our local hospital, becomes part of a corporate health system that's structured this way, there are issues of accountability precisely because of this. We don't always know who is governing our hospital, and that's part of what we're trying to find out so that we can get some answers. So that's the structure of the Provena Health system. On the back is just a listing of, under Provena Hospital subsidiary, the 6 hospitals that they operate, so people can see that. Now the next thing I want to turn your attention to, because it goes along with it, is the green sheet. And on the green sheet, it's titled Provena Health Corporation Board Lists. So remember that Provena Health is the parent company, and we have an address there, and these are the board members of that parent company. And you will see there's a couple folks on that board who are actually local people here in this community. And they're indicated because their names are underlined, and then there's a little icon or drawing next to them. Sister Evelyn Varbancourt and Donald Wendell. And if you want to communicate with them, you can do so at the Provena Health office, or Donald Wendell. We produced his home address where you can reach him if you need to. On the back side is Provena Hospitals. And remember, that's a subsidiary that operates our hospital. And they also have a board. And so here's a listing of their board members. And again, Donald Wendell is a local person from here who is on that board. And you can reach him at his home address, or you can reach him at the Provena Hospital's address. But we wanted to provide this information because at the last meeting, people were asking, would it be possible to go to the other boards? And yes, we can, and we'll talk about that later on. But what none of this tells you is who is governing our local hospital, because they refuse to provide that information, and we'll talk about that later. The other thing we have is just a handout on Provena Covenant Hospital's nurse staffing levels and a summary of some national studies. And then you also have various press clippings addressing this issue. And then you also have a sample letter to the mayor that we'll talk about later on. Okay. The next thing that I just wanted to say real quickly is that you'll hear this evening, there's going to be information presented about nurse staffing levels, and then also about trying to communicate with the hospital. And it's very important. We wanted to be able to do a little bit of education around nurse staffing levels, because there have been some national studies that have come out and have validated what the nurses in this community have been talking about, which is about unsafe staffing. And we will get to a point sooner or later. It might not be tomorrow, it might not be before the end of this year, but we will get to a point where we are having dialogue with the hospital to try to get information about the staffing levels and to understand those staffing levels. And in order for us to know what they're talking about and whether it's the right information that's being presented, we need to get ourselves educated. So to help us with that, here is Faith Henson.
Hi, my name is Faith Henson, and I'm a former Provena nurse. I am one of the registered nurses who have been outspoken advocates for improving the level of patient care and the working environment for the nurses at Provena. For years, nurses have been trying to bring their concerns to the hospital administration, but to no avail. Today, I would like to concentrate on nurse-to-patient staffing ratios. It is not news to us, the nurses in this country, that our workload has increased, that the patients in hospitals are much sicker, that we do not have time to provide the kind of care we were trained to give, that you, the patients, deserve and have paid for. For years, hospitals have dismissed our complaints and arguments as anecdotal, asking us for proof that harm is actually being done. Finally, after many frustrating years, several highly acclaimed reports have been issued and lend credibility to our claims. First, in 1998, was the Institute of Medicine's report stating that 80,000 preventable deaths occur each year in our hospitals. These are preventable deaths. We nurses believe that many of these deaths were caused by unsafe staffing, yet our voices were not heard. In May of 2002, the New England Journal of Medicine published a study by the Harvard School of Public Health researcher Jack Needleman and his colleagues, which was the first major study to document on a national scale the damage to patient health caused by inadequate nursing staff levels. In particular, the study showed that nursing shortages in our hospitals has resulted in increased deaths and illnesses. Dr. Needleman stated that he, quote, estimates that hundreds or perhaps thousands of deaths each year are due to low staffing. How much clearer can this be? More nurses at the bedside will save lives. But even this study did not seem to make the public take action. Finally, just last month, the Journal of the American Medical Association published the results of a University of Pennsylvania study by Ms. Linda Aiken, stating that, quote, for every additional patient added to a nurse's caseload after they have 4 patients already, that there is a 7% increase in risk of death. How would that make you feel if you knew your nurse was caring for 6 to 7 patients? She goes on to say that, quote, physicians agree, citing inadequate nurse staffing as a major impediment to the provision of high-quality hospital care, end quote. With this information, I would hope hospitals will staff accordingly with a maximum of 4 patients per nurse, but we'll have to wait and see. Right now, nearly 24 states are considering legislation on the growing hospital nursing crisis. Just 2 days ago, I testified before the California Department of Health Services, encouraging the state to quickly enact a bill signed by Governor Davis in 1999 to implement staffing ratios. Back in 1975 in California, the nurse-to-patient ratio was 1 to 2 was set for the intensive care units. That's more than 25 years ago. Recent studies are providing a link between the staffing level in the ICUs and improved outcomes. A Maryland study in 1997 determined that in hospitals where the ratio of ICU nurses to patients was 1 to 3 or greater, the patients had a significantly higher rate of medical complications and a longer hospital stay compared with patients in ICUs where nurses cared for 2 or fewer patients. Just a few months ago, I visited Provena's intensive care unit. There were 9 patients and 3 nurses. No dedicated charge nurse, no unit secretary, no dedicated nurse to watch the EKG monitors. Need I say more? I am now working in the intensive care unit at UCSF Medical Center in San Francisco, where of course the staffing is safe and the patients get the care they need and deserve. We, the community, need to demand the same of Provena. It is not a luxury to have a nurse at your bedside. It is your right. Unfortunately, here in the community, we will all need to fight for this right. As I said earlier, we the nurses have tried but have been ignored. Before going to the hospital, any hospital, it is your right to find out what the nurse-patient ratio is. It is your right to ask your nurse how many patients she has been assigned. It is your right to speak with a nursing supervisor or risk manager about your concerns if the staffing is unsafe. Perhaps you could demand now that Provena discloses their staffing ratios. In conclusion, let me read a short poem written by a nurse in Florida. She titled it, "But My Nurse Knew." Am I dying? No, I'm hurting from my injury and I can't walk. But my nurse knew, and she gave me some medicine. Am I dying? No, but I'm scared because my heart is beating so fast. But my nurse knew, and she knew how to make it slow down. Am I dying? No, I'm waking up from surgery and I don't remember anything. But my nurse knew, and she told me what was happening. Am I dying? Yes, I am, and I don't want to be alone. But my nurse knew, and she called my family to be my side. Nurses are very important. Now we must demand a change. Hopefully when you or one of your loved ones is next hospitalized, there will be a registered nurse at the bedside. Now I would like to introduce Pat Wittig, one of Champaign-Urbana's most respected and outspoken nurses and my mentor. She plans to describe to you the consequences of unsafe staffing.
Hi, I'm Pat Wittig, and I'm an ICU nurse. Have been for the last 15 years. What I want to just say to you is this. I want you to picture yourself as my patient. This morning you woke up and you had chest pain, so you came to the emergency room of the hospital. When you came to the emergency room, they admitted you to the intensive care unit. It's now 7 o'clock at night, and I'm coming in for the night shift. I'm 12 hours. So I walk into your room, and I introduce myself to you. And the first thing I need to do is to just glance at the room. I need to do a head-to-toe assessment on you in just a few minutes and get an idea of where we are. I need to know, are your pupils equal and reacting? Is your speech clear? Are you alert and oriented? When I touch your hands, is your grip strong and equal? When I touch your feet, I know that that's the farthest point from your heart. So if I can feel your pulse in your feet, I know that we're getting enough blood flow to your brain and your heart and your lungs and your kidneys. I also need to know when I touch your skin, is it warm and dry? Are you pink? Are you pale? Are you not getting enough oxygen? Are you sweaty because you're having pain, because your heart is giving you problems? So what I do after that is I'm looking at your EKG monitor because I need to make sure that your rhythm that you have is regular. So I ask you if you have any questions, any concerns. While I'm looking at your IV drips, I'm walking around the room, and you're probably on 2 to 6 IV medications. And each of those medications is something that I have to look at. I have to recalculate the dosages to make sure that we're giving you the correct amount of medication for what you have going on with you. I also need to know that each one of those drugs can either help to save your life, or it could kill you potentially with the strength of medications that we're giving you. Looking around the room, you have an intra-aortic balloon pump, which is a piece of equipment that we use to help take the stress off of your heart, to make it not work so hard. And with the pumps, with the monitor you're on, with the balloon pump, I'm responsible for operating probably close to about $100,000 worth of equipment in your room, just with you. After that, as the night goes on, you start to get a little short of breath. I hear a cough. Your oxygen saturation is dropping a little bit. When I listen to your lungs now, I start to hear some, what we call crackles. It tells us that there's fluid building up in your lungs, something that's going to cause you to be short of breath, to have a decreased level of consciousness. So I call your doctor, and he orders 40 milligrams of Lasix. So I have to put in a Foley catheter. I have to give the Lasix IV medication, which helps to, what we know takes the fluid out of your lungs to help you to breathe easier. A little bit more time goes by, and I'm talking to you in your room, and I've invited your family to come in because, of course, they've been sitting in the waiting room all day, and they're frightened. They don't know what the outcome is, and they have a lot of questions that need answering. So we spend time with your family talking to them. And as they go back out in the waiting room again, then as the night progresses, you're talking to me, and you're starting to have a little bit of chest pain. I look at your EKG monitor, and I notice that there are ST elevations in what we call in your 12-lead EKG, in leads 2, 3, and AVF, which is telling me, because I've been educated for this, that you're probably having an inferior wall MI, heart attack, that your chest damage your damage to your heart is increasing, and that you're having pain, so I need to give you pain medication. With this type of a heart attack, you're also nauseated, so you start to vomit. I need to give you something for that. And as we're taking care of all of these things, suddenly you're not speaking to me. And I look at your monitor, and I notice that you're in ventricular fibrillation, which tells me that your heart has stopped. Okay, at that point in time, I yell out of the room, and I say, call a code. Someone brings me the crash cart. 3 of the other nurses in the critical care unit come in to help me because this is a team effort to try and save your life. What I know is that our best chance of reviving you is within the first 60 seconds after your heart stops if we deliver a shock to your heart. But knowing that, I also have to know what amount of electricity do you use to have the best results of getting your heartbeat back again. The other things is there are multiple drugs that we need to give in this situation to try and restart your heart. Meanwhile, while these 3 other nurses are in my room helping me, they have patients down the hallway that are not being watched by anyone because this is a crisis situation. We try and deal with what we can at the moment. So after that, I call your doctor, and he says, okay, call in the cath lab. We do get a heartbeat back. We do get a rhythm back. You're starting to wake up a little bit, but you're not really oriented. Your doctor comes in, and he takes you to the cath lab. And while he's doing that, I finally sit down, and I try and reconstruct everything that I've done for you in the time I've just told you. The things that I've told you only cover probably about the first 1 to 2 hours that I've been taking care of you in a 12-hour shift. What I want to tell you is that you aren't my only patient. I have another patient who is at least as sick as you are, who is also down the hall, or if not sicker, and I really haven't had the time that I needed to spend with that patient unless he was in a crisis or she was in a crisis that we needed to address at the moment. So now what I want to ask you is this. What parts of the care that I have just delivered to you would you be willing to sacrifice because the administration is requiring us to take a second patient? And more recently, with the Director of Critical Care at Provena Covenant, there are many, many times now when the nurses are taking care of a 3rd patient on top of that. There is no way to safely take care of 3 patients in any critical care unit. I don't care what excuses they give you, what they tell you, because what you're doing is not providing the care that the patient deserves to have. The other thing I want to ask you is this. If every day that you went to work, you knew when you went into work that you were doing the best job that you could do at your job, but because the management of your job was making financial cutbacks, that they didn't provide you with the tools that you needed to do the job, you did not have the personnel at your work to be able to do the job you did, If you knew every day when you went to work that you were endangering people's lives, how long would you be able to do that job? Well, the statistics in the JAMA article that stated that there's a 7% increase risk of mortality with each patient that you have over 4, what they also stated in that study was that for each additional patient that that nurse has, it increases the chances of burnout, nurse burnout, so that you're going to lose that nurse by 23%. And it increases the probability of job dissatisfaction by 15% for each patient that you increase on that nurse's workload. So that I think that what I want to just ask you is, the next time that you go to the hospital, or someone that you care about goes to the hospital, when you're asking the questions about, when is my doctor coming to see me, I'd like you to please think about asking, who is the registered nurse at my bedside today, and how many patients beside me is she taking care of? Thank you.
Hi, my name is Nikki Hurley, and I'm going to kind of go along with what Pat and Faith have been saying. I am probably the most recent casualty of Provena Covenant Hospital, and although I didn't work in ICU with Pat and Faith, I did work in a cardiac unit, and the shortage of RNs in that unit too is extremely detrimental. Now, a reasonable ratio of nurse to number of patients is not 1 to 2. You can reasonably take care of more patients than that, but you can't take care of 9 on a cardiac unit as Covenant would ask you to do. It simply is unsafe, and you get into the same kind of scenario where problems happen, the nurse physically cannot be in the room to see a problem until it's a crisis situation. And that's some of what, as nurses and other staff members from the hospital, we're very, very concerned about, and why we're voicing this to you today. But besides just kind of the obvious things here that Pat pointed out, there's some other really scary things that Provena Covenant is doing. And one of those things is to say, and they've said this multiple times publicly, that we're placing more nurses at the bedside. But this is a tremendously misleading statement for so many reasons. And I will say it's true that Provena Covenant, they're putting more nursing hours at the bedside overall, but this is simply because nurses are now doing tasks that were once performed by aides, such as bathing, feeding, cleaning the room, basic things that take away from what the registered nurse should be doing. So you're in more patient rooms, but you have twice as many patients. So you're actually spending less time with each patient, which is, as we've seen, is very detrimental. If you can't be there to see what the problem is, that's when the problems get worse. Another thing that is very frightening that we're seeing happening at Covenant is they loosely use the term nurse. And there's a lot of different levels of nursing care, and Provena Covenant fails to disclose that. They say we're putting more nurses at the bedside, but they don't tell you that they're actually replacing registered nurses with licensed practical nurses, and there's a big, big difference. A registered nurse and a practical nurse have different levels of education, skill, legal responsibilities and capabilities. And this makes a big difference in the care each patient receives. According to the Nurse Practice Act, registered nurses are nurses who use their professional knowledge, judgment, and skills acquired by means of completion of an approved registered professional nursing education program. Licensed practical nurses are technically trained nurses who may only practice nursing under the supervision of a registered nurse, physician, dentist, chiropractor, podiatrist, or optometrist. And just to list a few of the things that registered nurses do on a daily basis for almost every patient that LPNs are neither trained nor licensed to perform include initiation of IV therapy, administering IV medications, performing complex drug dosage calculations, administering blood or blood products, doing a complete physical assessment of all body systems and interpretation of that data, at least 1 time per shift per patient, more if the patient's condition worsens, And then developing a nursing care plan. And this care plan basically dictates the nursing care delivered throughout a person's hospital stay based on his or her individual needs and the disease processes that this person may be going through. Teaching. LPNs are not allowed to do any teaching of any kind with a patient in the hospital. RNs do preoperative and postoperative teaching. We teach patients and their families about disease processes. We teach them how to take medications, what the medications are for, how to do wound care when they go home. We give them all their discharge instructions before leaving the hospital, and the list just goes on and on. And now what we're seeing is even though these LPNs are not educated and they're not legally able to perform these nursing duties, Provena Covenant is routinely replacing RNs with LPNs. Theoretically, the LPN is supervised by the RNs on the floor. But on my unit, for example, we're a 28-bed unit, and typically there's 4 nurses. 3 will be RNs and 1 is an LPN. So an RN that already has 7 patients, which is almost twice as many as she should have, is now responsible for supervising the LPN and her 7 patients. And usually that RN that's responsible for that is also the charge nurse for the entire unit. So you can kind of see where this is just simply physically impossible. Patients develop complications, and based on that Journal of the American Medical Association article, the likelihood of mortality increases for every patient that an RN has over 4. And it's very, very scary. So of my 8 patients, that's a huge statistic, the number of my patients that might die, despite my best effort of trying to take care of them. And to top it all off, legally, the registered nurse is accountable for everything that LPN does. So it's my butt if that LPN is not capable of taking care of those patients, or if I physically can't see what the LPN is doing with those patients. And so the RN gets scapegoated. The hospital says, oh, we're increasing staffing, but that's not true. They're decreasing the amount of help, they're decreasing the competency of that help, and the patients suffer. And this is simply an undeniable decrease in the level of care for patients in our community, and I really think that you all need to be aware that Provena Covenant is doing this.
Faith, did you want to real quickly talk about the JCO issue? Just briefly? Yeah.
Okay, I've been asked to describe a little bit about JCO that you probably hear about in the newspapers. And I'm going to tell you what it is and what it does. JCO stands for Joint Commission on Accreditation of Healthcare Organizations and is the nation's most influential healthcare regulator. Diane Friedman, the president and CEO of Provena Covenant Medical Center, frequently upholds their JCO accreditation as a stamp of approval that they are providing quality health care in a safe environment for the healthcare providers. But let me tell you, as anyone who works in the hospital well knows, JCO inspection is a farce. It is announced 3 months in advance. The hospital often prepares by hiring extra staff for the day of the visit. They diligently coaching the staff for JCO's questioning, preparing a few patients' charts to meet the JCO standards, painting halls, cleaning the furniture, etc., etc., etc. It is not a spontaneous visit. The Chicago Tribune on November 10th ran an expose of JCO, saying that JCO accreditation does not provide any guarantee of patient health and safety, and actually gives its seal of approval to medical centers riddled by life-threatening problems and underreporting of patients' deaths due to infections and hospital errors. For example, it documented just 12 cases of preventable hospital-borne infections since 1995. The Tribune found about 75,000 such deaths in just 1 year. This figure is supported by state and government files. And as we now know, more nurses at the bedside could have prevented many of these deaths. Despite its government-approved role, the Joint Commission exists as a self-regulating tool set up and run by medical professions to grade other medical professions. As U.S. Representative Pete Stark of California states, quote, "They are bought and paid for by the people they investigate, which is an absolute conflict of interest, end quote. Now to the financial aspects of JCO. This past year, the revenue was more than $100 million, generated mostly from fees it charges for these surveys. A mid-sized hospitals like Provena pays approximately $40,000 per inspection. Wouldn't this money be better used increasing the number of nurses? So why is Provena spending this money on JCO? Rather than responsibly addressing patient health and safety issues, Provena chooses to fire nurses who are reporting the inadequacies of the system that JCO should be finding and reporting. In addition, Provena dismisses the valid concerns of you, the community members, regarding the state of their hospital. There's something very wrong with this picture. The Chicago Tribune editorial on November 13th calls for increased nurse staffing and demands that hospital officials, quote, listen to nurses, end quote. That is all well and good, but we, the nurses, need protection from retribution when voicing our concerns. We need a Whistleblowers Act, and we need it now. Thank you.
I just wanted to say real quick, in case people were following along on the agenda, we flipped items 2 and 3. So now we're going to go back to item 2, and then we'll talk about the Whistleblower Protection Act and what the status of that is. But it's important for people to know why we're asking these questions that we're asking, and why we want to know about nurse staffing levels and what we want to know, not just hours, and we need to be able to distinguish between RNs and LPNs and so on. So thank you very much. And now I'd like to turn it over to Allison, who's going to talk to you about the Provena Covenant Wall of Shame.
Hi, my name's Allison. This is our Provena Covenant Wall of Shame. It basically just goes through all of the efforts that us community members have tried in getting dialogue with Provena Covenant Hospital. Kind of starts back in August 22nd. Champaign County Healthcare Consumers released a report, Provena Covenant Hospital 5 years after Provena, as only the name changed. Some of the findings of the report are posted up here. You guys can come and look at this after we're done if you want. The report basically recommended that Provena Covenant Hospital and Provena Health officials need to engage the community and address the concerns. So, okay. Well, throughout months of August and September, instead of responding to the community directly, Provena spent over $20,000 in up to, full-page ads in the News Gazette and the like. That's not engaging with the community, that's just PR. In September, obviously, as some of us know, Nurse Nikki Hurley was fired, and the other 2 nurses over here were banned from entering the Provena Hospital property. Nikki was fired the day after attending one of the community meetings. So maybe there's a correlation there. On September 23rd, Martin Nieto, he sent a letter to Diane Friedman on behalf of the community asking if she would attend a meeting sponsored by the community to address patient health and safety concerns, changing in staffing levels, working conditions, and the decision to fire these outspoken nurses. We also sent a petition of about 80 people to Diane Friedman asking her to address these issues and to give us the name of the local board so we could talk to them about these issues. Not until like 3 days before the meeting, Martine did not receive a response until then, and we finally got a letter back from Diane Friedman saying things like, our concerns are vague, unconfirmed, unresearched, and ultimately untrue, and that we have a money-motivated, slanted, and poorly researched vendetta. Patient health and safety isn't slanted. It's the way it is. So that was in September 29th, Provena Covenant refuses dialogue and attacks community members. October 10th, the day of the meeting, instead of coming to the meeting, writing a letter to Martine, to any community member, Diane Friedman thought it necessary to take out another $3,000 ad in the News Gazette, attacking Champaign County Health consumers and basically dismissing the community's concerns, which obviously should not be dismissed in any way. Letters to the editor still come in about how inappropriate this ad was and how it would have been much more suitable just to address the community. In September and October, a lot of you, over 150 of us now, have sent postcards to William T. Foley, the CEO of the Provena Health Corporation, and just basically asking him to possibly meet with us or, help us address these concerns. Well, in response to those postcards, we all know that we got a pretty nasty letter, basically saying that our concerns, we should take them back to Diane Friedman, but she won't talk with us. So everybody's just passing the buck. Who do we talk to? And basically, the letter also says that they should have, concerns about the legitimacy of Champaign County healthcare consumers. As a community advocate and healthcare consumers has been clearly irresponsible in its efforts to alarm the public about alleged patient safety issues. Is letting the community know that there are these issues doesn't seem to be irresponsible at all. It seems to be the right thing to do. Yes. On October 18th, we sent, Martin Nieto, once again, sent another letter on behalf of the community to Diane Friedman asking her to disclose the local board of Provena Hospital. This local board, they have said time and time again that this is how the hospital engages with the community through this local board. Well, we want to know who this local board is. If they make the decisions, then we want to talk to them. Up to this date, there has been no response to this letter. So, at the last meeting, since Provena won't talk to us, we will talk to them. A group of over a dozen of us went out front of Provena, once again asking for these board members' names. We had a simple form, name, title, address, phone number. Couldn't get much more simple. Why couldn't you give it to us? So, since we still didn't get it that day, Ms. Friedman was conveniently out of town. So, once again, another letter, this time sent by Claudia Lenhoff, asking Diane Friedman to tell us the name of the members, the board members. We want to know who these people are, who are governing our hospital. We have the right to know. No response to date. And basically, today we're here to have a no confidence vote. Do we have confidence in the system that passes the buck, the system that won't tell us statistics about health and safety, about anything? This is our basically wall of shame. You can come up and look at it. And now Brooke is going to talk about a little more about our action and a little more about the no confidence vote.
Thank you. And I really encourage people, take time afterwards to go up and check out the board. There's a lot of phenomenal things on there that you think just couldn't possibly come out of the mouths of hospital administrators, which have managed not only to come out of their mouths, but have come out on paper in writing. So you should check it out. We put a lot of time into it. Again, my name is Brooke Anderson. I'm a community organizer for Champaign County Healthcare Consumers. I want to tell you a little bit about the action that Allison referenced, and you can see afterwards the pictures and newspaper clippings and all that. But November 1st, actually a lot of you in the room here joined us for a community gathering outside of Provena Covenant Medical Center. And we gathered there to call on Provena Covenant to release the names of their local board, and also for us to show support for the nurses who are struggling with increased patient load and who are struggling with unfair working conditions. So that's what we went to do. There were about 30 of us who attended. There were patients, families of patients, former and current nurses at Provena Covenant, and concerned community members that all gathered outside. It was a very, very cold day. You can see in the pictures we're all bundled up, but it was important to us, so we were out there. We lined the streets there on University Avenue, about like between Romine and Wright Street there on University, with signs facing out toward the street. Some of the signs said, who is on the local board, or Provena Covenant, what are you hiding? Honk if you love nurses, was one of the favorite ones, which triggered a lot of people to honk. It was very clear there was a lot of support for the work that we were doing. People read the signs that we had out there. They'd slow down their cars so they could read. You could see them talking to the people in the other car, and thumbs up and cheers and lots of honks. Several people drove back second or third times around just to honk their horn for us. And it was clear that this is an issue that not only a lot of people feel, but people also feel very deeply about. This isn't interior decorating. This isn't issues of unimportance. This is everyone's health and safety. When people think about what Pat is saying about which one of these things would you take away, people think of their loved ones, and everyone in everyone's lifetime, in everyone's loved ones' lifetimes, people end up in the hospital. And it was clear that day with the kind of support that we received that this is an issue that people care a lot about. Following the gathering, we marched up to Provena Covenant Medical Center. They're on the sidewalks up to the front of the hospital. And Amy and myself formed a delegation to go into the hospital to try to deliver that form that has the local board of directors' contact information that we wanted filled out, as well as the letter. We went in and we were greeted by 2 cops who were very grateful we weren't bringing the entire protest inside. We explained that we respect the hospital, we see it as an asset, and that we see all of the employees there at the hospital as doing the very best job that they can, and we're there to support them and not to raise anyone's anxiety levels. But those cops were very friendly and escorted us to the administration's office and told us that Diane Friedman, coincidentally, amazingly enough, was out of town the day that we had come. So Amy and I delivered the form and the letter to the administrative office, and we haven't heard from them since. They haven't written us back. So that was the action. It received great media coverage, all 3 TV stations, News Gazette, Daily Illini, and we received calls at our office in the couple days after that with people saying they'd seen us on the street, they wanted more information, and we heard reports of people, of nurses in the windows looking out, trying to figure out what we were doing, and some cheering and some afterwards expressing their support to us. So it was really an outpouring of community support for what we're doing here, and affirmed that our concerns are valid and that we're on the right track with this. So why did we try so hard to get the local board information? I think that's important to explain because it's not a minor detail here in the struggle that we have. When people are being asked to bring their own pillows and blankets to dialysis, when people in our community with the least resources are being sued for medical debt and being bankrupted by a nonprofit Catholic hospital, it's important to ask who has the power to change this. This is an issue that affects people a lot. And as Allison said, we first went directly to Diane Friedman. We couldn't get anywhere with her. We went to the CEO of the parent company. He referred us back to Diane Friedman. She refused again to have dialogue with us. So we said, who else who makes decisions about this hospital could we talk to? The obvious answer was the local board of directors for Provena Covenant. And we can't get their names. And these are the folks that make decisions about how many patients are on your floor when you're here in the hospital. And it's unethical, it's deceptive for them, for this corporation to portray itself as responsive and accountable to this community, but then to make it a policy of keeping secret the names of the people who make decisions about this institution. It's unethical, it's wrong, and they're using healthcare consumers as an excuse not to give this information up. They're playing hide and seek with the information that's vital to our lives, and they're the ones hiding, we're the ones seeking. That's what we're all here tonight to do, is figure out how we can get that information and have our concerns addressed. Thanks.
Somebody who knows a lot about Provena Covenant's habits of playing hide and seek with information would now like to talk a little bit about his experiences. I wanted to introduce Patrick Jordan, and he's the artist who drew the picture that you have in your packet.
If you would, go ahead and pull this out and take a look at a portrait that I drew of Mrs. Friedman. She'd be the one in the lower left-hand corner. I'd like to make a disclaimer. My name is Patrick Jordan from Rankin, Illinois. That shows you that the community is larger than just Champaign-Urbana. My disclaimer is this: these are my opinions. If the doctors and the administration want to retaliate on my mom for what I have to say, don't do it. If you want to retaliate on me for what I have to say, don't do that either, because I've been cleaning up on their messes for so long and missed so much work that I've already been financially penalized. Okay? Who has ever talked to a clam? Have you ever picked up a clam and tried to speak to it? You can't. This is their tactic. We are going to get nowhere trying to open up this clam, and I'd like to bring your attention to some words first from Ms. Friedman, and this is a direct quote. CCHCC says that Provena Covenant needs dialogue with the community. What they mean is a dialogue with CCHCC. We already have a continuous, multifaceted dialogue through service on local boards participating in our Champaign-Urbana Roundtable, a Speakers Bureau open houses, our community magazine, our monthly calendar, the News Gazette, and continuous opportunities to feedback through our website and various customer relation channels. We also often meet with groups to discuss ideas and issues and act on them. We will continue to interact with and serve the community, but will not attend any of CCHC's self-serving sessions. These are her words. I am the community. She has never interacted with me. When I went to the information desk to talk to a patient advocate, those are the words I used at Covenant. They looked at me with a blank stare. Now, how can that be? Oh, well, they have a different name for it. It's called customer relations. Now, doesn't that speak more of a corporation and a for-profit industry than it does healthcare? Well, I finally addressed the patient advocate. We're almost coming up on a year now that nobody, absolutely nobody, has responded in any manner to that letter. So what I personally would do for this wall of shame is I would take the letter and I would poke it out here in 2001, and that started with me trying to open this clam up, okay? No success. It doesn't matter how strong I am because you can't argue with a clam. So we follow this wall of shame down, $20,000 of advertisement. The quote that I read you that says she wouldn't speak to CCHC is on this one for $3,000. If we took any amount of this money and put it towards what my mother experienced in the ER, and I will not diminish anything that was going on here with these fine nurses giving care to patients in a triage fashion. My mother showed up in the ER, and fortunately I had stopped her bleeding at home when she was rushed to the ER in an ambulance. She she laid there in the cold, she's hypothermic, for 45 minutes before she got a warm blanket. She waited an hour before she saw a doctor, and she had another 15-minute wait before the pharmacy delivered her pain medication. Okay, so Ms. Friedman, if you took this money to get more nurses or more doctors, would my mother have said to me, and I hope you guys have living mothers, she said to me, don't ever bring me to ER again. I don't want to go. Now, as a son, what options do I have? My mother had a bleeding condition that I had no capacity to work on. I was not a doctor. I did stop the bleeding. I got her into the hospital, and she said, don't ever do that again. Where does that leave me? And that's the quality of care we're getting for at least $3,000 here. So, I've been trying on my own earlier to get something done. I look over my shoulder, and I see CCHC is at the other end of the clam trying to open it up. So I decided, hey, reinforcements, we're going to work together. So what did I do? I did the right thing, following channels again. Sent a postcard to Foley. He says, I'm not going to talk to you. Clam. Okay? You need to talk to Friedman. It speaks for itself. She's not going to do anything.
Gabe Nunez wanted to, do you want to come up? Gabe has been inspired to do a little research that he will tell you about that's related to this.
Hi, my name is Gabe Nunez, and I'm a senior at the U of I. I've been coming to all the Provena Health community meetings, and I just found it hard to believe that the a list of the local board members weren't publicized. As a student in the health administration, we were always taught that the best outreach to the community, it's good to have outreach to the community because of it's to gain the confidence and the credibility. So I took it upon myself to call all of the Provena Health hospitals to see if it was a company policy to keep the names of the local board members a secret, because that's what I was told by Provena Covenant's personnel and PR. And like I thought, it wasn't a policy. I got a list of the local board members from 4 out of the other 5 hospitals. Really easy. The 5th hospital, which is Provena St. Joseph Medical Center in Joliet, was the only other one that refused to give me their information. They, like Provena, are also notorious for firing outspoken nurses and who are the union leaders to that hospital, like these nurses are for here. So to me, it seems like the hospital is like Provena Covenant, hiding things and doing things that they shouldn't be doing. And when nurses or community members want to talk about problems, the local hospital, Provena, just shuts them out. So I just want to say that getting that information was really easy. It was probably about 3 minutes, and I got the email from the other hospitals. So I don't know why it's taken comments so long to get to us.
Thank you.
So if you can reason with a plan, your only option is to pry it open and extract the information. Do we as a community have the ability to do it? We tried it through channels. I'm going to pose the question to you, and we'd all love to have some input. Where do we have leverage? Do we have any friends in local government? Do we have any friends in any healthcare organization that's going to be able to get in between those clamshells and help us pry open and get what we need so that we can go forward with this?
Patrick is saying something that a lot of people have said to us, that it's just completely unacceptable to not be providing this information. I mean, it's completely unacceptable, unethical, deceptive, and it's all about accountability. And a lot of people have suggested turning to local government. And one of the thoughts that we had, and if people are interested in this, you can talk to me after the meeting, but one of the thoughts that we had is, every body of government needs to be interested in this issue. The city of Champaign sold Burnham Hospital to allow it to merge with Mercy to create Covenant. And I've seen the historical records, and the records were that the city of Champaign worked hard to demand accountability for the future to try to prevent situations like this. So that's a body of government that ought to be interested. The city of Urbana, of course, is concerned and is doing some work on the Whistleblowers Protection Act, which you'll get an update on in just a moment, and the county board. I mean, which, the hospital serves a wide community, gets property tax. We shoulder the property tax burden for that hospital county-wide. They don't pay property taxes. So there's a lot of avenues that we can pursue, and if people are interested in that, maybe we can talk about that after the meeting. But what I'd like to do now is go ahead and turn it over to Milton Otto is here from the city of Urbana, and he is here to provide a quick update on the Whistleblowers Protection Act or ordinance that they're working on. And do you want to come up? And I wanted to thank him for being here to do this, and also thank him for taking leadership on that Whistleblowers Protection Act. And obviously, it's obvious to us, why we need it. Thanks.
Thank you. Ruth Wyman has also been somebody who's taken a leadership role, even more of a leadership role than I have in this process, so she couldn't be here tonight. But if you all ever see Ruth or have a chance to thank her for what she's doing, you should do it, because she's really put in a lot of work in terms of researching whistleblower protection acts in other places and other jurisdictions, and she's doing it all uncompensated while she's a student at law school. which is a long, hard slog. I've been to law school. You're very busy, and so it's especially impressive that she's spending all of this time doing all of this research, in addition to a very heavy class load. Our particular efforts at Urbana City Council to try to protect whistleblowers were instigated by a News Gazette story regarding the meeting, which was followed by Nikki Hurd's firing and pointing out that there were other nurses at the meeting who didn't speak out because they were afraid that they might be fired. And I'm a Democrat, so it's not very often that I say nice things about the News Gazette. It's not very often they say nice things about me. But I think it's really pretty impressive. Provena spends tens of thousands of dollars each year in advertising with the News Gazette. And for them to go ahead and write the story that they did and to run it is something that means that somebody over there has real journalistic ethics and is really following through on this. So I don't give them very many accolades, but that was an important story, and they wrote it, and they ran it. The reason that I'm so concerned, that I was so concerned about the story that I read is probably everybody here have a lot of experience, both myself and with family and friends in the healthcare system. I was also, after I graduated from law school for several years, as a trial attorney, and one of the things that our office did, among the many other cases that we did, we occasionally did malpractice cases. And the one thing that really stood out whenever you start digging into the medical records, talking to people, talking to witnesses, is the importance of nurses in the healthcare system. They're really the one group in a very dysfunctional system that looks out for patients, that sticks up for them. Everybody in that system, from hospital administrators to the doctors, down to the techs, has a fiduciary duty to their patients, with the interests of those patients ahead of their own patients, because patients are very vulnerable. They're as vulnerable as you can be. And it's unfortunate, but a lot of the players in the system are falling down and aren't taking that responsibility seriously. It's not to say that every nurse is perfect, but as a group, nurses really have stepped up to the plate. They've prevented a lot of injuries and prevented people who were injured from becoming more. One of the articles that I read when I was in law school was about, it was a law school article, and it was reporting on a study that was done by Harvard Medical School on iatrogenic injuries. Iatrogenic is fancy word for injuries that occur inside hospitals as a result of somebody making a mistake in terms of prescriptions or care or operating on the wrong limb or something. And only about 4% of patients who receive iatrogenic injuries are ever compensated for those injuries. The medical bills go up. Many of them don't even know what was the cause of their injuries. And the importance of nurses in being an advocate when a patient says, hey, I need help, or this doesn't make sense to me, this isn't the right medication, or, was given this prescription, but something doesn't seem to be working right. Being the one group in the system that listens to patients and can advocate on them and get the right person's attention to deal with their problem, to help their pain. It's incredibly important. Ms. Lampard.
Oh, I'm sorry. I was I was gonna ask you if you, people know about the Whistleblowers Protection Act, but they don't know where it is in the process. One of the things that I wanted to say is obviously the people who are working on it are very passionate, and you can see where that's coming from. But if you can also let people know, because the last meeting that we were at, originally, you know, there was a thought that it might be coming up in December, and that's shifted a little bit, right?
Sure, I'm getting to that.
Oh, I'm sorry.
So, we had, when I read the article, I talked to Ruth, and she agreed to do a lot of the research on how to pull this together. It's a pretty comprehensive undertaking. It's an unusual one and a difficult one. There aren't very many cities that have this kind of whistleblower protection act to protect people inside the healthcare system who are taking their fiduciary duty seriously and trying to protect patients and help patients when they need help. So she did a lot of research, and together we were able to put together a draft. Our goals in the draft were to make the protections as broad as we possibly can, so that anybody in the system who wants to bring something to the attention of the public, a problem, and make sure that it's addressed, to be protected from retaliation. And that applies not only to nurses, but to doctors, clerks, everyone. We also wanted to try to protect patients, something that I think a lot of other whistleblower protection laws have overlooked. There's only 2 hospitals in town, so if there is some kind of retaliation against patients in terms of denying them care, that can have serious repercussions. Although this act was instigated by this specific instance, it's not an act that's aimed at Provena, but at everyone, to open up the discussion, to open up the debate. Hospitals are a place that have a lot of disinfectant on hand, but when you're dealing with these kinds of problems, sunlight is the best disinfectant. And if there are disagreements about what happened, or what's appropriate or what's not appropriate, to have a discussion and have a debate, and be sure that employees of the hospital, and patients of the hospitals, or other healthcare providers will be protected. So that's our one goal, is to try to give as broad a protection as possible. The other one is to try to make sure that our protections will stand up in court. And that's one of the things that has been sort of delaying things, trying to do as much research as possible. It would be a tragedy if somebody spoke up believing that they're protected, and then a court later came along and said, well, this wasn't quite drafted right, or the city council overstepped its bounds and denied that person the protection of the ordinance. Because people who've lost their jobs, it's amazing that people care enough about patients that they would actually speak out and risk their jobs, and eventually they lost them. It's really heroic. Not very many people are willing to put their families and their livelihood on the line in that way. But we want to make sure that when we do get this in place, that it's something that will stand up. So, been doing a lot of review. We're providing copies of the ordinance to the city attorney. We're trying to encourage people to discuss it, try to shoot holes in it, find loopholes, so that we'll have something that will really stand up. So, right now, we've provided the act to the city attorney. He's provided some comments back to us on particular areas that we might want to look at, some criticisms that we might want to think about or try to address, and we've provided a response to the city attorney. So we're not sure how quickly that's going to come, but I'm hoping it'll probably be, given the schedule in the holidays, and that we don't meet as often over the holidays, it'll probably be in January sometime before it comes to city council. But that's a little bit about what we're doing and how soon we can hope to see it. So.
Okay. Mr. Otto is going to stick around for a little bit after the meeting, so if people want to talk to him, they are welcome to. So the people who are working on that are just incredibly dedicated and committed and working very hard, and we don't get to see the work that's happening, but they are moving it along and trying to do it. It's not too early to start expressing support for this, and so I just, I always try to do, do what we're also asking people to do. So in your packet, you can see a copy of a letter that I wrote to the mayor of Urbana, expressing appreciation and support for what the city council is trying to do. And I really would urge everybody to try to do that. The other thing is that a lot of people are interested in going to the city council and just verbally expressing their support. We don't know exactly when this is going to come before the city council because of the work that Milton was describing, but several of us are planning to go to the meeting on January 6th to the city council, and so we'll probably be talking to others of you about that if you're interested. And that's not the only meeting that we can go to, but I just wanted to let people know that several of us will be going to that, and we can use support, and obviously the folks working on it could also benefit from the public support for this. Okay, well, we said we were going to take the vote, the no confidence vote, at 7:15, and it's just about that time. But what I wanted to do was to see if, I do want to have questions and answers that you can direct to the people who have spoken, or just comments that you want to make. But just for right now, I wanted to see if there were any questions pertaining to the vote before we get to that, and then maybe we can talk more after we take the vote. Okay, everybody, do people have a ballot? Let me just review the ballot real quick. I know some of you feel strongly and already marked your ballot, but I wanted to explain where the idea for this came. And basically, this is a very strong message. What we're doing this evening by taking this vote is a very strong message from the community. It's an unusual thing to do. But we are not alone in doing this. And the idea for this came from a lot of physicians who reported to us that in late October, the Provena Covenant medical staff, which includes physicians with full-time privileges at the hospital, that includes Christie physicians, independent physicians, emergency room physicians, and Provena employed physicians, took a no confidence vote and overwhelmingly indicated no confidence. So when we heard about that, we thought, well, that is a very strong message to be saying. They sent a strong message saying they had no confidence in the Provena Covenant Medical Center administration. And given Provena Covenant Medical Center's administration, through Diane Friedman and the hiding of the board and so on, we thought that it's time for us to put this kind of measure in front of the community to see how you all feel. And just real quickly, it's a very simple ballot. You mark an X in the box that best represents your position. The no confidence, we just, say that this is expressing serious concerns about patient health and safety, staffing levels, working conditions for staff, and the management of our community hospital, Provena Covenant, under the current administration. It is also a statement of belief that Provena Covenant administration's lack of communication, openness, and respectfulness in its relationship with the community is unacceptable for our community hospital. We talked about why we need to be having dialogue with the hospital, why we need to be getting the kinds of answers to help us make choices and know about our hospital. And this vote is joining with others and calling for the dismissal of Provena Covenant Medical Center's CEO, Diane Friedman. For the folks who do have confidence, it's an expression of that the hospital's staff and patients are in good hands, and that the hospital's administration has been acceptably open, forthright and respectful in its communication with and attitude toward the Champaign County community. And it's basically a statement of believing that Diane Friedman, the CEO, is doing a terrific job. So folks can choose, and if you mark your ballots, then several people, you can pass them in towards the inside of the aisle. You can fold it up if you want, and we have some folks who are going to come around and pick those up if people are ready. I hope I didn't rush anybody. And after they pick them up, they're going to take some time to tally ballots, and then we'll get the results, and we'll put them up on the board and add them. Some people might be wondering, well, I don't know if y'all are or not, but people might be wondering, you know, what do you do with this? You know, we take the vote, we get the results, what do we do with this? The no confidence vote is something that can be communicated along with all the other issues. It can be communicated back up to the subsidiary, Provena Hospitals. Remember that handout that has all those board member names and so on? It can also be communicated to the parent corporation to let them know. They have a website talking about what Provena means, what they do, the promises that they make to their community and so on. And it's a way for us to communicate to them, you know, that we've lost confidence in them. Our hospital, we have tremendous concerns, and that we're not going to go away, and they need to address those. It's also something that can be communicated to other agencies, state and federal government agencies, along with all these other things as well. So it's a tool that we can use, but it's a strong measure. You don't start out taking a no confidence vote. Allison and Brooke and you know, Patrick with his experience talked about everything that has led us to this point. So it's a pretty strong and drastic measure, and it just basically says that this bunker mentality by our hospital doesn't inspire confidence, and it causes us to wonder, what are they hiding? And you know, from a lot of people's perspective, Provena is a corporation that breaks promises. They came into this community and they said nothing but the name has changed. And we're hearing in the past 5 years, virtually everything has changed. So I wanted to find out, while the folks are tallying the ballot, if people have questions or comments, or you want to talk about other things.
How much of this is part of the larger picture that we see as a community with Provena? It appears to be, and I say appears to be, deep sixing Christie Clinic and Christie Clinic doctors, which for a number of us in the community, because Christie doctors' reaction, many of them now, is to leave Christie Clinic and leave our community. So some departments in Christie Clinic, such as psychiatry, for example, they had 4 psychiatrists. By the end of December, they will have 1, by the way.
Oh.
Just in case you didn't know. There are other doctors fleeing in other departments, and I don't have figures on that, but on the psychiatry department I know for sure. This, of course, impacts then Provena Behavioral Health, which right now is taking no new patients, period, at all, because they are overloaded from the Christie situation. So how does all of this play in the larger picture? Because what you just said about Provena says nothing is going to change in our community, and obviously everything has. Is there a way we could go into even the larger picture here and see that what's happening to the nurses is just a horrible thing, but also one part of the larger picture of what's happening to the rest of us?
Yeah. Before addressing that, Jet, did you want to say?
Yeah, I was just gonna add, I mean, yeah, definitely speaking to that experience. I know for me, my psychiatrist is leaving Christie. They had 4, will now have 1, and are not replacing, and intend not to replace those. So you're putting that burden that many people onto one, which is already hard enough to get an appointment in any psychiatry place. And it really limits for people, because that's one of the, for certain insurances, that's like your only option is to go to Christie. So yeah, it is a very significant problem.
Yeah, I mean,
One of the other things I want to say is that when you're talking about how it impacts the entire system,
I think what a lot of people don't realize is just with Provena Covenant also owning personal care, part of what they've done with personal care is that arbitrarily they've decided that there are certain services they're not going to cover. I know for a fact that with physical therapy, they used to cover like warm water physical therapy out at Results at Country Fair. They no longer cover that as part of their physical therapy department. So not only that, but arbitrarily too, they've decided they can decide what providers you can see in the system. You know, if we don't have the physicians here in town, you have to go out, you have to stay what's within our system, but someone outside of town. So you may not have that coverage here. You might have to go to Chicago for the care that you need. You might have to go to St. Louis, Indianapolis, you know, Springfield, to another city. And they've also changed, just on a whim, the way they're paying for prescription coverage. You know, they've changed around how much they're willing to pay on certain prescriptions and just changed the category it falls into. So maybe if your copayment was $5 or $10 before, it's now $35 for the same prescription.
I don't, yes?
They, by owning personal care, they're also using it in a very not so subtle way to also try to get rid of, or at least exclude doctors who've been in this community for many years. By bringing in, for example, one neurologist operating under the Provena name, and then telling two neurologists who've been in this community for well over 20 years each that they can't be personal care doctors. Now, they're still doctors, they still have admitting privileges, but guess what? A big chunk of their reimbursement plan, a big chunk of their patients are now going.
Right. I think, you know, all the issues that you raised, Provena says that they are about building communities of healing and hope. And what we're seeing is, at the hands of a nonprofit, faith-based Catholic health corporation, we're seeing the disintegration of our healthcare system. And, you know, as you point out, it's not just about the hospital. It's about the whole behavioral health system. It's about disrupting physician-patient relationships. All of us know that continuity of care, that when we find a physician who we can work with, who we trust, and who knows our health and our lives, that is something to be treasured. That relationship is to be treasured. We value nurses. Nurses are the ones who save our lives in the hospital, keep us alive in the hospital. That's the only reason you go to a hospital. A bunch of the procedures that are done in there could be done outside of a hospital, but you have to recover from that. You have to be kept healthy from that, and that's what, you know, nurses do. So this is all about just completely disrupting our healthcare system. Corporate health, and we've already dealt with it a little bit in this community, but corporate health, in the biggest, worst way, has come to our community. And how we address it, we just keep going. We just keep doing more and more. And tonight, here's what we ended up doing. This is a strong message of the people here. And I also wanted to say some people called in and emailed their ballots because they can't come to the meeting. No confidence. Absolutely no confidence. There's not a single person here who has confidence. So this is a strong message to be sending, and, you know, we just need to keep sending it and keep going, identifying regulatory agencies. You know, we'll be working together to figure out all of the next steps. But I think, you know, one of the things that we always try to talk to Provena about is about, you know, that healthcare isn't just about building buildings. And, you know, when you look at the ad that's there, I mean, the thing, they talk about people. I don't know which ones they're talking about, but they talk about people. But what they tell you is about what they've built, what equipment they've brought in, and so on. It doesn't matter. If you don't have nurses to operate that equipment or to monitor it or, you know, to keep people healthy, it just doesn't matter. Those aren't our priorities. Those are their priorities, and that's something to be, you know, challenged. This is a story that's unfolding. Everything in the national news right now is about healthcare. Everything that's coming out, the JAMA study, is what these nurses have been telling us and have been telling, you know, for a long time. Michelle?
I just wanted to make a comment. A couple of times I've seen it and alluded to in letters to the editor and to people that I've spoken to, and one of their comments is, oh gee, why Provena Covenant? Aren't they just kind of picking on Provena Covenant? Isn't this just kind of happening everywhere? And I give them two really strong reasons I feel like why this is particularly important. One, because they blatantly fired 3 very good nurses that had no previous, bad write-ups or anything. And number 2, because they hide behind their religion. And I am a practicing Catholic, and I did write a letter to the editor as far as that's concerned. And they say that they're faith-based. And, I think people forget that in the Nurse Practice Act, we are directed and held legally responsible for unsafe patient care. I mean, we are held to that standard that if we see unsafe patient care, we have to report it. And to fire somebody because they reported something they're legally held to do is just unconscionable. We shouldn't even need a whistleblower act because the law tells us we have to do that. And I can guarantee you that if you have 7 or 8 patients and you're supervising an LPN, and the LPN accidentally gives the wrong medicine that night, is the hospital going to say, oh gosh, that nurse was just so overworked and understaffed? It's okay, honey, we're going to take care of you. No, it's not going to be the LPN. It's not going to be the hospital. That nurse is going to have their butt on the line. And we know that, and that is why we have to report it. So I just get so angry when I think that they would fire nurses for standing up for something that they have to do legally. It's like telling a mandated reporter they shouldn't report child abuse. And then on the other one, secondly, I have to say, and there was a nurse from Provena Covenant who wrote in the paper, well, this is how it is everywhere. That doesn't mean it's okay. I mean, I don't know about you guys, but my parents said, just because Johnny jumps off the cliff, does that mean it's okay for you to? I mean, that's just so infantile. And, as far as as a Catholic, I really encourage anybody in this room who will dare say they are, to write a letter. I receive no repercussions from my church or from my pastor or anything like that, because it's really important that people don't hide behind religion. I mean, it's happening all over the world. People hide behind religion, and it's not right. It's not right to treat people the way they do and say they're faith-based. And I think we need to hold them accountable for that, because that's what they're saying. I've known a lot of nuns, and I just cannot believe that 3 little groups of nuns said, yep, we're going to do a corporation and we're going to screw people. But I don't know, things have changed.
Thank you. I just want to say too, this is not happening everywhere. I think we all really need to understand that. I worked at St. Mary's Hospital in Decatur, a very poor community. I worked there for a number of years. And this hospital took care of patients. You don't replace the carpets and build new buildings and retile the entire facility to look pretty and then fire nurses and not have equipment. They did not do that. They took care of patients. And this is a very poor Catholic hospital, and they did what they had to do. But then here in town, we see Provena Covenant spending tens of thousands of dollars on ridiculous, worthless newspaper ads, but I don't have a job. They spend millions of dollars on recruitment of physicians when we already have those physician services in this community. I mean, it's ridiculous to spend that money. Millions of dollars in new construction, but you can't have a thermometer to check your patient's temperature. You can't have enough nurses. It doesn't make sense, and it's all financially driven, and I think we need to say enough is enough.
Over the last couple of years, both hospitals no longer sell or repair wheelchairs.
Oh. Nice. So is that another cutback?
Well, I mean, it's gone to other services, there's like respiratory and national seating, but Provena, both Provena and Carl don't do equipment, sales of equipment, which is getting real difficult for people with particularly motorized chairs.
So another loss in this
Yeah.
community.
I was gonna say, can you repeat the question, because someone's in the back of me?
Barb was saying that both hospitals within the past few years, couple years?
In the past year and a half.
Within the past year or year and a half have stopped selling and repairing wheelchairs. So that's another part of what we talk about in our report is about the trend to contract out services that used to be performed by the hospital that are now going to for-profit corporations, which drives up the cost of healthcare for everybody, makes particular services inaccessible, and so on. So,
I have a question about those for-profit entities that we know that Provena Covenant contracts with. Do they benefit from the not-for-profit status?
well, that's actually one of the questions that we're asking in this report, because they have large national for-profit companies operating within the hospital, doing things that used to be done by hospital staff, used to be done in-house, and now they've contracted out. And that's one of the questions that we're asking about is, what is the benefit to the community for doing this? Does it bring us cost savings? Or does it increase the cost of healthcare because for-profit companies have to make a profit? And, so that's a question that we're trying to get the answer to, but again, they won't talk to us, and that is a legitimate question, because a nonprofit is not supposed to exist for the enrichment of a for-profit, whether it's a wholly owned subsidiary or some other company that you're invested in or whatever. So those are some of the questions that we're asking about. It also brings up questions about accountability, because the dialysis unit, Patrick, who was here earlier, his mother has the misfortune of needing dialysis services and is getting them through the unit, and that's been contracted out now. That's being run by Renal Research Institute's a for-profit corporation. How do you make profits off of really, really sick people and off of Medicare? You do cost cutting. You take away blankets. You take away pillows. I mean, that's not about quality of care. So those are really important questions, and that's part of what we're trying to ask. I guess I'd like to go ahead and formally wrap up. People can hang around and talk a little bit. Before I let you go, I just want to, again, thank everybody who was here to speak. Thank Milton Otto from the Urbana City Council. The words that Michelle said just a little while ago, I think, again, speak to the importance of really showing support for the Urbana City Council's effort to get this Whistleblower Protection Act passed, and as soon as possible. So we'll be calling on people to come out and join us on January 6th at that meeting. I also really want to encourage people to write a letter to the mayor. That way that can be distributed to the city council as well. The letter doesn't even have to be as long as mine was. It can be half that length or even just shorter. Also, we're happy to talk with people about letters to the editor, writing letters to the boards. You have different information. And also, if people have ideas about other places and other ways of communicating this no confidence vote, we will be communicating it, and we'll involve everybody in that process. And that's about it. And then I just also want to invite people to come up and check out the board. It's pretty amazing, and Brooke and Allison put a lot of time working on it, and a lot of you contributed ideas for it. So I wanted to thank everybody very much, and we'll keep on working, and feel free to come and talk to any of the people who spoke today. Thank you.